All right, good morning. I am Becky Tuttle, and it's my privilege to be City Council member representing District 2 for our great city of Wichita. And this morning we're at our District Advisory Board representing District 2. And we have some guests with us today. We have a very special guest, Adrian, with the Sedgwick County, I always have to say it right now, Division of Health. It used to be the Health Department when I was there. Yeah, so super excited. She's going to give us some updates on vaccine. And then also glad to have Tim Johnson and Dee Neiswanger with our district advisory board who have joined us today. So thank you for being here. And of course, I always want to thank Corey. He's the one who makes everything happen and everything come together. So thank you for your time. But I know we have Fire here who's going to give us a quick update. So if you maybe want to just let us know a little bit about what's going on in your world. And we were having a little chat before this got started, how the cold even impacts what you do. So we appreciate your time, and we'll give you a first stage so that way you can get off and get back to your job. But thank you for being here with us this morning.
Hey, thank you. I'm Mike Crosby. I'm the battalion chief at Station 9 at Kellogg and Edgemoor is what we call it. Battalion 3 on the C shift. Just a quick rundown of January fires. That's what a lot of people want to hear about. For January's report, we had 3 fires, 700 block of South Drury. That was pretty significant, $60,000 loss. It's still undetermined. It started in a bedroom. Apartment fire on South Rock Road, 2200 South Rock. Pretty minimal, $1,000 damage. And 8725 East Lakewood Circle, or Lakeland Circle, I'm sorry, $50,000. And that was related to a discarded cigarette. We see that a lot. Discarded smoking materials, apartment complexes on wood decks, mulch piles. It's not limited to apartments. We see it at actually commercial buildings. People going in and flipping into the mulch. So I'm not a mulch guy. I say put rock. But that's the report. I can give you incident totals. 466 for District 2. That was in December. So I anticipate things will probably pick up as the cold spell continues. Like Becky said, there's fires that go on every day. We just don't see about it on the media.
Yeah, absolutely.
I don't know if there's any questions. Something real big that hit us the other day was this cold weather. I don't know if you're familiar with the ice rescue that occurred in Far East Wichita. Yeah. Doggone it, put your pet on a leash. They don't know the difference between concrete, grass, and ice. And that poor puppy was out in the middle of that lake. And we've modified our responses to those through this cold spell. We're going to send more people initially on those. So we've learned and we're doing better. This goes for everybody too. Something I'd pass along is the home maintenance stuff. Make sure the hoses are unplugged from the water spigots. We do go on those water calls to shut somebody's water off. And also take a visual of your roof vents. I've seen this happen to where the moisturized exhaust that comes out builds up, ice builds up, and actually it'll plug some of those vents on the roof. The pipe's coming out. And consequently, we show up and we get high CO readings, and it's because a lot of those vents are plugged up with ice.
That's interesting. I hadn't thought about that.
Yeah, we're just like you until it happens and we see it. Sometimes we're not even aware of it. We don't think that deep, but it does happen.
Well, and yesterday, the city of Wichita at 1 o'clock, we did a winter weather media advisory, and fire was there. And one of the things that they talked about too is more people are using space heaters, I'm sure, right now. Yeah. And so if you are, make sure that if it's an older model, that you're extremely cautious because they don't have the no tip feature that the newer models have. So if you have friends or family or neighbors or colleagues or anyone who may be using a space heater, just to make sure that they're using safety precautions so that they don't accidentally tip it over. Pets can tip it over, they said too. Yeah. So make sure that if you have a pet, that it's somewhere that the pet can have access to. So
and plug those things directly into the wall.
Yeah.
We run into problems with power strips overloaded on those, and they have a pretty heavy pull on the electrical system when they kick on. Also, along those lines of accessory heating, we tend to see a lot of fireplace-related emergencies. Most commonly, people don't open their dampers, and the house fills with smoke. Not a big deal, but it's one heck of a mess.
I did that once. I can tell
Guilty.
you. Yeah, guilty. It was a
Yeah.
mess. Yeah.
Yeah,
So
and so we run into that quite a bit too.
I smelled like a campfire for a week. It was awful. So
And you weren't even at the lake.
I wasn't even at the lake. All right. Any questions for fire today? Excellent. Well, thank you for being here, and
You
thank
bet.
you for your service. We really appreciate what you and your team do. So
I'm pretty
stay
open
safe.
on this end. If you guys got any questions, Corey has my email. So if you've got anything or you want to stop in, feel free. We're here for you. So, and there's always coffee too, by the way. So,
and I need to bring y'all some more treats. I haven't baked in a while. I'm sorry. So I need to get back on it. So
all right.
Treats
well,
coming your way.
All righty. Bye-bye.
Take care. Bye-bye. Have a great day. Well, next, it's my pleasure to introduce my dear friend Adrian, who is, as I mentioned, the director of the Sedgwick County Division of Health, and for the last 11 months has been working tirelessly. I remember you first came to City Council, I think it was March 16th of 2020, and it was the first time that we all heard the word we had heard of coronavirus. We hadn't heard it called COVID-19. And I remember thinking, oh my gosh, I wonder what this is going to turn into. And I don't think any of us had the expectation back then that it would be what it actually became. But my thoughts and prayers are with you and your team every day. We used to work together at the health department. We worked together in H1N1, which was such a minor pandemic compared to this one. So I can't even imagine how you and your team are keeping everything going, but you're doing a fantastic job. So we just wanted to have you come and maybe give us some updates. I did see now the limit, the age limit dropped from 80 to 70 for folks who are wanting to be vaccinated. And, I know there's lots of questions that I'm getting from constituents of, is there any extra? Can I jump in line? Or if I'm a 50-year-old healthy person and haven't had the virus yet, when will I expect mine? So we didn't really give Adrian any formal agenda. We just said, hey, give us what updates you can and a forum to ask questions. So Adrian, thank you for being here, and we'd love to have some comments from you, and that I bet we'll have some questions.
Okay, and you are welcome. And here it is 8:37, and I already learned some new things this morning from our friendly fire person. So now I know some extra things to look out for. So when I think about commonly asked questions, one is why are we getting the amount that we're getting, and what's going on with Kansas? Kansas is 1% of the population of the US, and so the state of Kansas receives 1% of the vaccine. So Kansas KDHE has been receiving approximately anywhere from 42,000 to 47,000 doses. And when you think about all the Kansas counties, that doesn't necessarily go very far. So in the very beginning, when they started getting vaccine, it was going to the national pharmacy programs, although I think it took a little while for us to get vaccine for our residents actually, but it went to the hospital so that we could get the docs and medical staff and other staff that were being exposed to COVID, and in the ER, just all the hospitals taken care of. So our first shipment was right before Christmas, and we received 1,400 doses. Had no idea we were going to receive 1,400 doses. We thought it might be around the amount of health department staff we had. And then at the same time, two of our federally qualified health centers, one being HealthCore, received 2,000 doses, and Grace Med received 9,000 doses. Now, Hunter Health receives their vaccine separately from Indian Services on a federal level, but the others were receiving through KDHE. So at that time, HealthCore kept their vaccine because they had plans on what they could do with it, and Grace Med kept amount of vaccine for their staff, and then asked if we would take 8,500. And so at that time, we hadn't been ready to stand up a large clinic. We thought it might be end of March, April, before we'd have enough vaccine to stand up a clinic. So we quickly, since we had been planning, set up a clinic and started vaccinating people with the 9,900 doses that we had at that time. And we're targeting healthcare associated workers with that 9,900 plus either 90 and older, 87 and older that we started vaccinating. So that's why Kansas receives what it does. It is 1% of what is being manufactured on a federal level. And I hear there may be more, that the amount may start increasing beginning next week. So we'll see, because the goal has been to manufacture more and just to get more people vaccinated. So let's see, what were some of your other questions, Becky?
So one question that I get not a ton, but I mean, I've had several, and I think you've done a great job of helping me to answer it, because we live so close to Butler County, especially in District 2, Andover's our neighbor. I have people saying, I live in Wichita and I am, 60 and I can't get a vaccine, but in Butler County, they can. And
Yeah.
so maybe just a little explanation of that each state, each county, I'm assuming, has their own plan and it's not a statewide plan.
Well, that has, nothing with COVID has really been a smooth rollout. It's been since the very beginning, when we, knew it was coming, but had no idea to what degree it would take hold. It has just changed rapidly, sometimes, daily. So now I do have a couple notes down here. So everybody was supposed to be in phase 1, and the message from the state health department, although some of the health departments in Kansas, we have frontier health departments, we have rural health departments, there might be staffed by 3 people or 5 people, and they each wear about 10 different hats. And I don't know if they always listen to the state meetings, but the directive was, if you have leftover vaccine when you are through with healthcare associated workers, let KDHE know, and we will redistribute it to an area that didn't get enough for their ER docs or people working in the COVID unit. Well, that wasn't happening. Suddenly we were hearing that teachers were being vaccinated. And, I said, what the heck? Because it makes it really frustrating for people when so many different things are going on. At the same time, we are such different sized counties. And I know that KDHE has some sort of algorithm, and they also look at, population size and the amount of population in each group. But there's just some people were thinking, we're small enough. We're just going to keep on vaccinating people because we're so excited about having this vaccine and we want to get vaccine in everybody's arm. And so started going into phase 2. Well, Dr. Mins and other doctors in town and I had a vaccine prioritization committee. And when we looked at the number of residents 65 and older, and depending upon what you look at, the census is like 100,000, other numbers, but there's at least 75,000 65-year-olds and older. And so, our concern was, if we opened it to 65 and older, as some communities were doing across the US, that the older in that group would be just really kind of trampled over, and that they wouldn't get to the computer to get, or their loved one wouldn't get there to schedule them an appointment. So we decided, let's start with, now all the numbers are blurry, but there were 11,000 80-year-olds and older. So we started with either 90 or 87. And when we saw openings, then we dropped it down to 87, dropped it down to 85. And why are we starting with 65 and older when some have jumped the 65 and older and gone into critical infrastructure? Well, because we know from data that 65 and older are more at risk for hospitalization and death. And the older one is in that group that increases that risk. And so that's why we've been doing what we've been doing and staying really true to it, because of those residents being most vulnerable. Even if they don't have chronic conditions, they're most vulnerable for death and hospitalization. And so that's why we, to the frustration of many, and I can appreciate it. I mean, I understand that we've been sticking to it. So I've heard a lot of I mean, try to answer all emails and get them, daily. And one of the big struggles is, I'm a cancer. I mean, I'm not only a cancer survivor, I'm going through chemotherapy currently, or I have all these pre-existing conditions, and put me, why won't you get me in? I don't know how CDC derived their phases, but people with chronic conditions aren't until phase 3. And at this point, we haven't been given the okay to jump from one phase to the other. And the concern is if we do that, we could jeopardize vaccine allotment. So, we were told that we could move within the phase, which is why some have skipped 65 and going to the critical infrastructure and doing various things within phase 2. So at this point, hopefully we'll be down to 65 in the next week or two. One of the things that really slows getting new vaccine, getting people vaccinated in the newer groups is that now is the weather, because we have a lot of people canceling because it is just brutal outside. And we did open a drive-through very quickly when the first day we opened up to the older population, and it was windy at Interest, and it was awful. A couple people fell just watching them struggle get to their car, and they, when we'd ask, can we walk you to your car? No. Tom Plitzer gave me ideas of how to deal with that afterwards. So we opened up the drive-through, and the drive-through is not for convenience for anybody. It is only for those with mobility issues,
Sure.
where getting into the arena would be a struggle. So on walkers, and the arena has some wheelchairs, but they don't have a lot of wheelchairs. So those have been in use. And then when the weather became very cold, we, maybe it was Monday, all the days kind of blur together. We changed our appointment times, where we were just doing every other hour appointments so staff could get inside. We have traffic workers, traffic control, that there's no shelter. And even the ones inside Wichita Transit, and thank them for allowing it, that it is a great location. Wichita Transit, the bays are open and it's frigid in there unless they're right close to the heaters. So we're trying to get them inside for an hour and then still be able to serve some of the population, but 90 appointments a day aren't going very fast. So we've been turning over all stones with temporary services and have gotten more staff in to rotate out. So that's double, not much, but we're getting more in there. So when there's always dose 2s coming. So 3 weeks after we received our first allotment, and we would never know when they were going to come. And so one of the frustrations of people would be, I have a life, I work, get the darn calendar up there so we can schedule appointments to get in. We would know 12 to 24 hours before the vaccine was coming and how much. And so we couldn't plan. And so as soon as we knew it was coming, then we would get calendar appointments on the calendar, and then those would go so quickly. And then the second allotment we got, I believe, was 2,000, and that was 3 weeks later, and did the same thing, 12 to 24 hours, found out when it was coming, got it up on the appointments up, and then they were gone. So 3 weeks after, we got the same amount for the second dose, because every time we get a shipment, if we get 1,400 first doses, we're going to get 1,400 second doses. So now we are getting Pfizer, because we are one of a handful that can have the freezer, Sub-Zero special freezers that can handle Pfizer. And Pfizer is very different from Moderna, where Moderna is like any other vaccine. You pull it out of the vial and you put it in someone's arm. With Pfizer, you have to reconstitute it. So you have to add it, and all of this you have to thaw. Moderna, once we thaw it in the refrigerator, its life is 30 days. Pfizer, once we thaw it, it's a 5-day window. Once we puncture a vial, and room temperature for Pfizer, it's 6 hours. And so that's why we have a call down list. So we're just getting Pfizer now. And so the reconstitution, you have to add saline solution to it. And then you have to do this 10 times. If you shake it, you ruin it. Very delicate vaccine. So now we're getting, so Pfizer is 5 out of every vial. Moderna is 10 out of every vial. Pfizer across the country, they were seeing that we could get 6 doses out of every vial. So now they're counting 6 doses out of every vial. So the call down list, there is not a wastage. In the very beginning, when someone wasn't, there was 1 dose wasted. And now we've given, not counting yesterday, 23,000 doses. 1 dose wasted when we were at the end of the clinic and someone wasn't aware of the call down list. And then someone jerked, some vaccine was lost. So 2 out of that. We have ensured, I've heard the stories around the country, but there's so many rumors at the same time. Vaccine is like gold because there's not enough of it. And so we want to ensure it gets in everybody's arm. So we had a call down list at first. We had health department staff on the list because we didn't vaccinate all the health department staff at first. We were only doing those that were going to vaccinate and those that were doing sampling. And so we put the health department staff on the call down list. Now we have moved on to public safety. And so we have public safety on the list and who are also in phase 2. So we do everything we can to stay within that phase. And the thing about the call down list, it's at the very end of the night and we give people 20 minutes, 30 minutes max. And so if we call someone and they say, I can't get there in 30 minutes, we say, okay, and we move on to the next. And we do that because by the end of the night, staff have been there for a very long time and they are ready to go. So and even though on a call down list, we still could be there an hour and a half after the clinic closes, just because everyone you call 30 minutes. So now we are doing, we're still doing, we started first dose. Is that Lonnie? No, someone in the background. So we started first dose Pfizer. We still are doing second dose healthcare associated workers. We're just about through on that first allotment. Some of them haven't come in. So we're starting to call them now to say, hey, there's 1,500 of you we're seeing out of all that number that haven't come in. What's going on? Get on in here. Because now CDC has said that you can get it up to 6 weeks after your first dose and still be okay. Now, we still want people to get it on that date. It's 28 days between Moderna shots, 21 days between Pfizer shots. It's best to get it right around that 28 or 21 day. There is a 4-day window. Now they know that there's a 6-week window where you can, but we really don't want people to use that window if you're traveling or sick or whatever. So we have second dose healthcare associated workers, first dose Pfizer healthcare workers that didn't get in before, first dose of the older population. And yesterday we started, that wasn't the smoothest rollout, but we started second dose Pfizer. So there's all these different first dose, second dose, and it's always going to be that way throughout the life of vaccinating. So the second doses interfere somewhat with giving the first doses. So in the beginning, when we weren't getting that much vaccine, that was an okay thing. Well, this is the 3rd week that we have received. It's 5,700 doses, or 5,200 is what KDHE is calling it, but it's more than that because there's 6 doses versus 5 doses out of each vial. So now what we've started to do, because we do not want to sit on vaccine, we want to get it into people's arms. There are clinics and pharmacies, Kroger's that are approved vaccine providers in Sedgwick County. So we have called all of those providers to see, why did you sign up to be a provider? And some of the clinics signed up because they wanted to ensure their staff were vaccinated because they're not being sure how it would roll out. And then others want to give it to their patients, and then some the community. So whoever we distribute to, they need to stay within our guidelines. And so right now, let's see, we distributed to USD 259, and they're starting with their 70 and then going to 65 next week. Hopefully that we'll be able to go to 65, and we'll be teaming with Kroger. Kroger's looking at having a big site once more vaccine comes in. We know that there are pharmacies that began receiving doses on yesterday, totally separate from us. That vaccine is not coming from the health department, though we've reached out to these pharmacies and Kroger, because Kroger might receive 1,000 doses, and that's for all of Dillon stores. Walmart might receive 1,000. That's for all, Walmart stores in Sedgwick County. So when you think about it, that's not very much. So there's more vaccine being manufactured. And so we are going to be slowly getting more in our community, which is exciting and needed, but it's going to be in small allotments. So since we're getting more vaccine, we're reaching out and saying, hey, we know that you're getting this federal vaccine. Do you want some Sedgwick County vaccine or Kansas vaccine? And if you do, then it's 70 and older, that we're asking you, so that it doesn't add to chaos. So this person's doing 65 and this person's doing teachers, but Sedgwick County Health Department is only doing 70. So Kroger's on board, and USD and other pharmacies want to be part of that, because they know that they want to take the vaccine they can get, because there's just going to be a small allotment for the time being. So next week, we're going to be distributing to more of our partners that are able to vaccinate people. So slowly but surely, and the more people that vaccinate 70 and older, the quicker we get to 65 and older. The more that vaccinate 65 and older, the quicker we get to all teachers and to all public safety and so on. And if Dr. Minns, we really would like the ability to move between phases. And so I put that out there with KDG yesterday. Dr. Minns would really like to move those those that are most at risk with serious illnesses into phase 2. So we're pushing for that. And again, I don't understand all the decision making. We don't, as to who is in what phase, and we don't agree with who is in what phases, but we're following it because that is the plan.
So one question that people have asked me is, and thank you for that. That was fantastic. So let's say that, I'm not in the range, but somehow I'm able to get a vaccine. And I think people don't understand that you can't switch between Moderna and Pfizer, right? Your second dose has to be the same. Because one of my friends said that she got a call, she's in her early 30s, that if there was, I can't even remember where it was, but if there was vaccine left, they would call her and then she could go. And I said, but how do you know you're going to be able to get the second dose, right? I mean, is that a concern for people? Does that make sense?
I think I didn't hear exactly what you said. You froze for a minute on my end. I'm sorry.
No. So one of my friends who's in her early 30s got a call from someone, I can't even remember, that they were giving vaccine, and that they said, hey, if we have any left, we'll call you and you can come. And I said, yeah, but isn't there a risk that maybe then you might not be able to get the second dose in the same category? I'm probably not explaining that very well, but
so it's like a call down list at the end of the night. If for every first dose that we receive, we're going to have a second one.
okay.
So if she's called and it's so when we had, and I was pretty rigid about this, when we had Moderna, our dose 2 Moderna for the healthcare associated workers, when we had an extra dose and staff would go, hey, we can call this person to get him in. And no, we have to stay with that second dose. And so call someone. So then we would look at who all were close to getting their second dose. So if we had a healthcare worker that would be on 28 day on Monday, we called them on Saturday and said, hey, we're day 26. It's in that range for you to get your vaccine. Are you willing to come in and get that? Because of not knowing what the flow was going to be like. And I look at it as you're giving someone's second dose away. Well, KDHE is telling us if someone comes from another state, they've moved to Kansas, or they're here for whatever reason and they need a second dose, give them that second dose, because it'll all, end up in the wash that someone else has an extra dose and will get that to you. So there have been a couple situations where that has happened, where someone came from a different state because of a new job, but hadn't started yet. Someone is here from a different state taking care of an elderly patient. They're going to be here. Well, we vaccinated them because they're part of our community right now. So there are those exceptions, and that we're, doing what we can to get those people vaccinated.
Sure. I know Dee has a question.
Hi, Adrian.
Hi, Dee.
Could you speak a little bit about congregate settings and how people in, for example, long-term care nursing homes, or those, I work with people with disabilities, and we get calls every day about our people with intellectual and developmental disabilities that live in group homes that may or may not be in the 70 above. That's a pretty narrow scope when we start talking about the whole population with disabilities or in long-term care. So can you talk a little bit about long-term care settings and how those decisions are being made? And right now, those who are living in congregate settings or being cared for in congregate settings are being vaccinated?
So right now, those in residential are long-term care facilities for the older population. And that decision was made just because of the older one is the higher risk. The data has shown ending up in the hospital and greater risk for death. So a lot of the long-term care facilities were part of the national pharmacy program, and in Kansas, Sedgwick County, it was Walgreens and CVS. And then we found that there were some that weren't part of that. And so that vaccine wasn't coming from us. That was coming through federal, through KDHE, putting it into that national pharmacy program. So we weren't part of that. And then we found that there were, and plus it took, I bet you 3 or 4 weeks for a lot of our residents to get, it just took a long time to get vaccine to all those nursing homes in United States and Kansas to get those most vulnerable vaccinated. But we found that there were some that were not part of those federal programs, and they were having arrangements with their health departments, like the smaller areas, rural or frontier, or some kind of an arrangement with KDHE. Well, we started calling, we're working with the department, our friend Annette with the Department of Aging, to find out just who the Kansas KDHE, we're calling them orphaned, who aren't taken care of. And so we weren't sure who all were taken care of, and we weren't able to get that list. I mean, there's so many moving pieces on a state level too. So we got a list from Annette Graham, Department of Aging, and we had a team call all of the long-term care facilities to see if they were part of the pharmacy program or how they were being taken care of. So there were several, and so we arranged with them and went in mobile clinics and vaccinated their residents. And then there was a surgery center and another center that somehow got left out of being taken care of. So we went in and vaccinated their staff. And then KDHE they found out that there were others out there, and we had already used had our vaccine allotted, and so reached out to Health Corps because of vaccine they had, and they've gone in. Well, just this week we found out like 2 or 3 others that weren't taken care of. And so, we're arranging to go in and take care of them. So now we're also looking at assisted livings and independent livings. Those are a little bit, the ones in long-term care facilities really don't have that mobility. So some of the residents in the independent living are pretty mobile and can, go about in the community. So we're seeing how to do that, because that's a little bit trickier, because oftentimes they have their own apartments. So it just makes it much more difficult staff-wise on how, resource-wise on how to get out there, since we just can't have a mobile clinic in a courtyard because it's so cold. So that's the focus currently, because of age being quite a factor. Now we know there's other conditions that put people at risk, but that 65 and older group are where most of the deaths and hospitalization. So congregate setting, and this is not Sedgwick County Health Department. This is CDC, and KDHE is supporting CDC. So congregate settings that we'll move on to, and again, that the high risk medical, Dr. Minns is doing some research this weekend. He and I had a conversation about populations that if we can move up, that we will. But right now, as it stands, we would move on to all teachers after we do 65 and older, all teachers, public safety. We need to get to veterinarians. KDG added them in the first phase. I have a lot of veterinarians very unhappy with me. KDG added them in the first phase. Later in the first phase, we already had all of our vaccine allotted. And so I kind of pushed them off and went to the next higher risk. So we'll need to put veterinarians in there as well, because they are in contained small rooms with people in the community. And then, there's congregate settings in there. I mean, there's also critical infrastructure with public transportation, bus drivers. So the congregate settings, we're looking at the jail population. And I know there's controversy around why would you go in and vaccinate inmates before somebody with cancer? Well, we have to look at that there's a lot of staff, there's a lot of people in our community, that public safety, corrections officers, that are working, and they have, and so why would that population be high in phase 2? We're also, it makes sense to us because we know where the clusters have been, we know where cases have been, and so that's part of that decision making for us when we were looking as a vaccine prioritization committee, that let's have the data guide us as much as possible and look at what populations have been more prone to have outbreaks, have been more prone to have cases. And we know residential facilities like jails, long-term care facilities were very at risk for clusters. So we're moving our way through that. And at this point, I'm trying to think who all is in the congregate settings.
So I would be
Probably-
remiss if I did not take the opportunity to advocate for people with intellectual and developmental disabilities who live in group homes. Some of them live with 2 or 3 other people. Some of them live with 8 or more other people. We've had clusters in our service system. We also know there's research that shows that people who have intellectual and developmental disabilities have significant co-occurring underlying conditions, which put them at risk. There's a research article that recently showed that people with Down syndrome have 3 times more likely to have a bad outcome. We also know that historically, people with intellectual and developmental disabilities have been marginalized and not prioritized in terms of their rights to have that. And so I know I'm preaching to the choir with you, Adrian, but how are these populations being advocated for with the prioritization committee? Because we don't hear them getting access.
Well, unfortunately, there's a lot of groups that aren't getting access, and again, that committee, it is within phase 2. We can't move into phase 3. We'll see. We'll see. I'm going to have a conversation with Dr. Mins next week about what just what direction that we're going to go in. But you know, it has been very clear from CDC and from our state health department that we are to stay within that. But congregate settings at that point, are not going to be just the older population. If it's a congregate setting, there's going to be a long list of congregate settings where people need to be taken care of, whether it's mobile, and some of those are going to need to be mobile because there are mobility or other issues. So as we get closer to those, you know, right now, and I know everyone's very focused on their population, as you should be, you know, advocating and fighting for that. So right now we've been really focused on age and haven't really been diving down into congregate settings, but a lot of places are going to fit into that congregate settings. We haven't been looking at the critical infrastructure yet because that is a huge, and there's still not only so much guidance about that. So that group is going to be soon, and we will be transparent about what all, because congregate setting is congregate setting. So, you know, we're going to be transparent about who all falls into that group. And then we'll be reaching out to everybody to let you know.
So I know another challenge is having enough people with the appropriate qualifications to be able to actually administer the vaccine. And so just again, because this is what my community has charged me to do, is to say that there are congregate settings that have medical staff who are able to deliver the vaccine. So, you know, there is a way for us to leverage potentially those resources to administer for that population as well.
And we rely on that. So that's something that's really important, just because of how many partners that there are in the community. When there's medical staff, we are all over that to be able to partner, have a small group of our medical staff, since so much is needed at wherever location that we are for our major clinic, and then mobile currently, that any opportunity we have, just like with USD 259, their nurses who are vaccinated, the ones that chose to be, they're going to be vaccinating their staff. So absolutely, that will be an important part of getting out there and getting people vaccinated.
So my other question was, if community members wanted to volunteer to help the health department with this heavy lift, how can community members who are civic minded and want to volunteer connect with the health department to do that?
Well, there is a volunteer group called Medical Reserve Corps, and they were actually established after 9/11, where really a lot of funding started coming down for public health with preparedness, because they found that public health did not have the infrastructure to stand up in the way that they needed to during 9/11. So Medical Reserve Corps was established because during 9/11, there were so many people that showed up to volunteer that would say that they were doctors, nurses, whomever. And afterwards, you know, it became aware that they just believed that people had those credentials. So the Medical Reserve Corps was established, and those credentials are verified, and it's just part of that group. So people can go to, I know there's a Medical Reserve link, but I'm sorry, I don't have it. If you go to the Sedgwick County Health Department webpage, on the left-hand side, you'll see Medical Reserve Corps. Click on that. It'll take you to the sheet, information sheet to fill out. And then we do a KBI check, and HR does a background check. We need anybody, but really need medical staff. And we have had quite an outpouring from the community, which is fabulous. So we have put another person on there because it's just been overwhelming. And so people are going, hey, I'm a nurse and I volunteered 3 weeks ago. Why haven't you called me if you're in such a, dire need? So we're on top of that. And it's been really great just how the community has responded.
And to
Anyone
clarify,
that,
you have
volunteers-
opportunities for other people who aren't like me. I can't deliver a shot, but I could, somebody like me could pick up somebody and help with transportation, or maybe run paperwork from one station to another, or empty the trash
Yes.
or whatever. So I know there are a lot
Yeah.
of people out there that want to do things to help that can't deliver shots. So where
Proud
do
people,
folks like
proud
that
people.
sign up?
Same place, Medical Reserve Corps. So you can do some of the things that I've done when I've been over there, and then I've heard was badly needed yesterday. Was someone there to remind people to social distance, and or to do registration, to help with data. People are standing in line checking to make sure that someone is 70 and older. Make sure someone's a healthcare associated worker, check to make sure they have their paperwork. So there are things, and well, right now traffic, but it's that someone's quite a trooper if they volunteer to be out in traffic, but we do need people in traffic as well. So yes,
And if there, sorry, and if there were groups like, Girl Scout troops or church groups or, other, civic groups that would want to get together, maybe my neighborhood wants to, get a group together to volunteer one day or, something. Would those groups also still go through that same thing? Or is there someone at the health department they can
And
contact?
anyone that wants to volunteer needs to go through the MRC. And
Okay.
with the amount of volunteers that we're getting in right now, we are prioritizing those that can possibly do it at least once a week, on a regular basis. Because if you can imagine, trying to manage that schedule is something. Because we know what staff that we have, that we've hired, but sometimes we won't know from a temporary agency for sure until 3 days before exactly all that we have coming in. So it's that is quite a beast in and of itself. And so having people that can be as regular as possible, or maybe just on a Saturday because they work Monday through Friday. But it's been a good experience for people when they have volunteered, because even when we have long lines, supper from yesterday, that was really long lines and some struggles there. But even when we've had long lines, people have a lot of gratitude for just being able to get that first vaccine, first vaccination.
Great questions. Any other questions for our dear friend Adrian?
And I can tell you how many people have gotten their second dose now. And I'm not counting yesterday because we increased our numbers massively. It's kind of an experiment, but increased our numbers massively yesterday, and then started giving second doses. And that took a while to get started. And so I think they were probably a good half hour late. And that was a snowball because our older population like to show up like 2 hours early.
Yeah.
So really, which then puts everybody behind and people get frustrated because they're, so we're asking anyone to not show up more than 15, 30 minutes because then the parking is difficult. And if someone has an appointment, there's a shot with their name on it. Think of it that way. There's a shot with your name on it. So showing up 3 hours early, like one person did to the drive-through yesterday, we have your shot. We have your shot.
Yeah.
So out of the 23,000 doses that we've given, and it's more today, we have approximately 16,500 people that they have their first dose. And out of those 16,500 people, over 7,000 people have had both doses.
Wow,
And we
that's
know
great.
There's a good amount of protection after the first, but you really need that second dose to be totally protected.
That's great. Well, this has been fantastic.
So bear with us.
Yeah. From the
bear with
very,
us at City
yeah.
County Health Department.
from the very
It's-
beginning, I said the number one thing that's, and I said this back in March of 2020, the number one thing that's going to get everybody through this is grace and adaptability, right? Having and extending grace for other people because everybody's doing the best that we can. We know the health department is, and then just being adaptive because every day seems to be something new. So we just can't thank you enough for everything you're doing, Adrian. I know this has probably been a toll on your personal health and your, personal life and your family, and you're doing it for the community. So we really extend our most sincere appreciation for all that you're doing.
I have a great team, and there's lots of, just like the ones dedicated, standing out there in 3-degree weather, vaccinating people. So
Yeah.
I'm very fortunate, but thank you.
Well, I'm looking forward to the day when COVID-19 is in our rear view mirror and not our windshield. And hopefully, the second half of 2021, that will be the case. So looking forward to it.
Here's to that.
Yeah. Well, anything else? Yeah, cheers to that with your coffee. Anything else for the good of the group? I know we have some other folks. Lonnie, if you have any comments or questions about anything or anything else in District 2 or the city, I'd be happy to try and answer. Mr. Roth, anything we can do, let us know. Any questions or comments before we wrap up for today and let everybody go get a second cup of coffee? Or third?
I just love that we have this opportunity. And now, even though it's looking at the silver linings, the virus has given us the opportunity to even be more accessible through virtual meetings. And I know there's probably not a lot on today, but when we do it on Facebook Live, we can also share it out later with our neighborhoods. And so I do appreciate that. It's one thing I love about our community is how accessible local government is to be engaged and informed. So I'm grateful for the opportunity and hope that folks watch this on the replay, because Adrian, you've given us such great information and insight that folks wouldn't have otherwise. So thank you for the opportunity.
I agree. And, I tell Corey, I always, I have a lot of anxiety before when we do it like this, because when we had our normal in-person breakfast, which I can't wait to get back to, we'd have 20 some people, every time we do it. And here the numbers are smaller, but he assures me people go back and watch it. So our reach is probably the same or even more. It's just in a different environment. But me being such a social person, I like to see lots of faces. So, so Adrian, rest assured, this was worth your time, and we'll make sure the information gets out to other folks in the community.
It'd be
as
worth
well.
my time, even if it was just you guys.
Thank you. Thank you. Thank you. Well, I hope everyone has a wonderful day. Stay warm. Please stay safe. Try, stay in as much as you can. If you have pets, make sure that they're in. Talk to your friends and family about the space heaters. Make sure everybody's staying safe during this time. And I look forward to when we can be together in person. But another big thanks to Adrian for all you're doing and for your time this morning. And then also to Corey for always making sure that everything is set up and ready to go. It makes my life a lot easier. So I'm grateful for that. Thank you. Everybody have a great day. Happy Valentine's Day.
Yeah.
Take care. Bye-bye.